In terms of diagnostic capacity in the country, we have managed to make strides from the very beginning. To date, we have 33 laboratories that are conducting testing. These are constituent of both public and private laboratories. We have testing facilities available in the following counties: in Nairobi, Kisumu, Mombasa, Kilifi, Wajir, Kericho, Uasin Gishu, Machakos, Busia, Nakuru, Kajiado, and Trans Nzoia. They're all doing COVID-19 testing. And in terms of laboratories, it becomes important to remind you that the National Influenza Center, the National HIV Reference Laboratory, that form part of the National Public Health Laboratory Framework are conducting testing. Kenya Medical Research Institute laboratories in Nairobi, Kilifi, Kisumu, Alupe are all conducting testing, including Cambridge CDC laboratories that we have again in Nairobi, in Kisumu, Walter Reed, Kericho. We've also partnered with different facilities. We have laboratory facilities present at ILRI. We have KNH offering testing facilities, MTRH, Coast General, Wajir County Referral, Machakos County Referral through the architecture that I've just described, Busia, Kitale County Referral, Malindi, Aga Khan University when it comes to the private sector, Nairobi Hospital, Lancet, AMREF, Mombasa Hospital, KU, all these, and IOM, as well as Pathcare Kenya Limited, all have diagnostic capacity. And this is a great improvement 154 days later. In addition to this, we have deployed mobile laboratories. These have been deployed to different border points. Maai Mahiu, Namanga, Malaba border, all have testing capability there and continue to support diagnostics when it comes to COVID-19. In terms of screening, like I mentioned, we remain alert at our border points, at our points of entry. And as we continue releasing new protocols and guidelines, we continue to implement mandatory screening of cargo vessels, of crew who are coming in. And cumulatively to date, we have screened around 800, a little over 800,000 individuals have been screened across all points of entry. And even as we move towards opening of airspaces, as we've done, stringent protocols are underway. I'm happy to report we've received good reports of adherence in terms of the different airlines when it comes to ensuring that these protocols are effective as an infection prevention control measure. With regards to our COVID-19 statistics today, 650 people have tested positive out of a sample size of 6,768 samples, all collected within the last 24 hours. It now brings the total number of positive cases to the country to 28,754. Of these cases, 633 are Kenyans, whereas 17 are foreigners, 391 are male, and 259 are female. The youngest is a 1-year-old baby, whereas the oldest is 97. In terms of distribution by county, Nairobi leads the pack at 356, Kiambu has 53, Nakuru 48, Machakos 26, Kajiado 20, Busia 20, Uasin Gishu and Laikipia have 15 each, Bomet 10, Bungoma 9, Migori, Mombasa, Kisii have 7, Tharaka Nithi has 6, Murang'a 5, Narok, Turkana 5, Kericho, Makueni, Kitui, Samburu have 4 cases, Embu, Baringo, and Nandi have 3 cases, whereas Kisumu, Mandera, and Marsabit have 2, Isiolo, Trans Nzoia, Nyamira, Elgeyo Marakwet, and Nyeri having 1 case. We are happy to inform you that 490 patients have recovered from the disease, of which 308 are from the home-based care program, whereas 182 have been discharged from various hospitals. And so our total number of recoveries is 15,100. And we continue to extend our appreciation to our healthcare workers who have made this great achievement possible. And on a sad note, 4 patients have succumbed to the disease, bringing our fatality count to 460. We do continue to extend our sincere condolences to the families and friends of those who've lost their loved ones.
So far, more than close to 60% of our recoveries have been from home-based care. Even though our recovery rate lags behind the global average, this is just because of reporting like today. The figures we have given to you are basically reports of discharges from 23 out of the 47 counties. And of course, we cannot delay the pressure because we have to wait for the figures. So going forward, you'll see our recovery rate match and probably even exceed the global average, more so that 90% or more of our cases are asymptomatic. So this is a platform that we are going to use going forward, strengthen further. Once we are done with the training of community health volunteers, we'll then be able to use them to be able to train members of the household at community level, especially as we approach our peak.